Welcome to the RX class. I'm your host, Dr. Guang Chen. Thank you again for the ongoing support. And today I had a question from my patient who wanted to know a bit more about x-rays. Look, we'll have a formal episode with a radiologist coming up in the coming weeks to months. However, I thought I might give a bit of a take of how I see x-rays or radiology in general and how they apply to my clinical practice. Look, before I start, a quick disclaimer. Please note that throughout the podcast episode, the information presented is general in nature and use at your own risk. Complex concepts may be oversimplified for entertainment purposes. Symptoms and medical conditions, as well as the diagnosis and treatment of these conditions, may be mentioned. The information presented does not constitute the practice of medicine nor replace medical advice from a licensed medical practitioner. Do not rely on the information to make decisions about your or someone else's health. Please seek help from a certified health practitioner if you have concerns or symptoms. Radiology, alongside with pathology, as we spoke about previously, has become an important component of our diagnostic tools that we use as doctors and specialists. However, sometimes patients ask, well, why do you use this? Why do you use X-ray? Or why do you use CT? Why can't I have an ultrasound? Why can't I have an MRI? Well, I'd like to give you some of the rationale that goes behind some of my decision making to help you understand what other doctors might be thinking about. I generally think about the diagnostic tests, whether that be pathology or radiology, in a couple of ways. The first one is the specific technology and what the test was initially designed for. Second is safety. Third is access. Look, I must say, I live and practice in Sydney, Australia, and I'm very lucky that we have most of the technology available very close to hand, whether that be in the public or private system. And for most patients, they pay very little out of pocket, if at all, for many of these tests. It is very different if you work in rural and remote areas and also in places where the technology may be available or the costs may be very high. And so I like to go through each of these modalities to tell you about what I think is relevant. The first is X-ray. X-ray has been around for a long, long time. If you've ever had an X-ray, the setup is fairly simple. There's an X-ray machine where the X-rays are generated. It passes invisibly through the air. Generally, as a patient or as a person, you stand in between the X-ray machine and the X-ray film, or now a digital film, in the back. And what you also notice is that before the X-ray pictures are taken, the radiographer, which is the person who's helping you take the X-ray, goes behind a glass screen or behind the door before they say, breathe in or hold your position, and they'll say, well, I'm going to take the X-ray. And the reason for that is that, look, X-rays are part of the electromagnetic radiation spectrum, similar, you could say, to Wi-Fi or to light. And there is a very, very small risk of radiation. And that's why and that's the reason why radiographers who have to do X-rays every day go behind a screen to protect themselves. But overall, in terms of the danger to the individual patient, it's usually very low if you're having a single X-ray. Sometimes you may hear figures, if you were to go for a long overseas flight, it might be equivalent to more than 10 X-rays. However, in terms of otherwise the safety, we are mindful if we do X-rays on children or pregnant women. Now, the technology of X-rays essentially uses the idea that these rays, as they travel through and penetrate or come into contact with things in its way, some of them get bounced off or they get absorbed. And so at the end, you get a difference in terms of the number of rays hitting the film or the digital film. For some of you may have seen TV cartoons of X-rays showing up the bones. And that's a great example. And so when X-rays hit the bones, majority of the X-rays get absorbed into the bone and very little hits the film. In contrast, when the X-rays go through the air, very little is bounced off or absorbed, and all of it essentially gets captured at the film. And so we get a great contrast between air, which is typically seen as black, and bone, or something very dense, typically seen as white. Similarly, as if you've got a metallic prosthesis, such as a prosthetic knee or a prosthetic hip, those would come up as white on the X-ray. Now, X-rays are very old technology, but still very good. And today we typically use X-rays to see things with high contrast. And as we said, it's great at looking bones. Generally, if you have a bony injury, such as a sprain or what might be thought as a fracture, the first test would be an X-ray. The radiographer would take the pictures in different views. So you might get one from the front, one from the side, and then one at 45 degrees. And that gives us the ability to locate any changes in a semi-three-dimensional format. Other ways that we can enhance the images include the addition of contrast medium. And so these are generally substances either taken by mouth or injected into the veins, which absorb X-rays very well. And so the typical contrast medium that I'm familiar with is barium, and we use this in the context of what's known as a barium swallow or barium meal, where in this particular situation we want to see the function of the food pipe or the esophagus as one person swallows. And so the patient is asked to drink the barium swallow, which is a liquid containing barium, and as they swallow, we take live X-ray images to see as it flows down the food pipe or esophagus to see if there's any blockages or narrowing or any changes to the natural flow. Now, next we move on to CT or computed tomography. CT is really an advanced computerized form of X-ray. And rather than having one X-ray, the CT machine takes hundreds, if not thousands of X-rays very quickly, generally over a few seconds or a few minutes. And the X-rays are taken in a spiral or spinning formation. And the images are then captured by the computer and then reformulated into a 3D format. And when you look at a CT, we get views we get three typical views, and these are a bit technical, but I'll just explain to you and describe what they are. So we have the axial plane or axial view, which is if we're taking pictures looking from above you or from below you, if you can imagine, either from the head or from the feet, and we're moving up or down the body. And then we've got a coronal plane or a coronal view, which is where, as if we've got a giant knife or guillotine, and we slice you in between the ears, and we're able to move the images forwards and backwards. And lastly, we've got a sagittal plane or sagittal view, where essentially, if you can imagine, we've got a giant knife or guillotine to cut you right down the middle, in between the eyes, and again we can move left or right to give the different views. And all these together gives us a 3D reconstruction of the particular region or even the whole body, depending on where the scans were taken. The benefit of CT is that we can see deeply inside the body, in particular internal organs such as the heart, lungs, kidneys, liver, pancreas, and the definition of the images are much, much greater, especially if you're looking at soft tissues. Those soft tissues, generally, we're talking about anything that's non-bony. Whereas on X-rays, soft tissues are hard to see because they're all compressed into one two-dimensional image. Again, to make the images more lively or to add more detail, we have the ability to inject contrast dyes, and also for the ingestion of contrast dyes. Again, with these contrast dyes, they tend to absorb the X-rays more compared to the other soft tissues, and therefore we get definition. One example with contrast injection is something that I work with in terms of liver disease, is what's known as a quad phase liver scan. And so with a standard liver scan, we would typically take a CT prior to any injections, and then there will be an injection, and then there'll be a scan actually done a couple of minutes after the injection goes around the body. But with a quad phase scan, we actually do 4 phases. We do a scan prior to the injection, we do a scan at the time of the injection, we do a scan a couple of minutes later, and then also about 20 minutes after that. The reason for that is that, in particular with the liver and also other organs, as the dye travels around the body, it gives us different information at different time points. And in terms of the liver, different liver lesions have different appearances in these phases, which allows the radiologist or X-ray doctor to help us identify what these lesions may be. The downside with CT is obviously that there is quite a lot of radiation, and so each CT scan may be several hundred X-rays. The benefit of CT really is that it's a very rapid test. We can get information very quickly. So it tends to be used, for example, in emergency situations like the emergency department or the emergency room. And it's generally fairly accessible. So next we've got ultrasound. If anyone has had ultrasound, you'll know the basic setup. the machine, and then we've got a transducer probe that the sonographer or the radiographer holds, and then depending on the body location, you get a bit of cold jelly, and the probe would go on, and you'll see these kind of fuzzy grey images on the screen. Some of the positives and I guess some of the pros and cons. Ultrasound is very safe overall. There is no radiation risk. And that's why we can use ultrasound in pregnant women to look at babies and fetuses. At the same time, ultrasound can be very quick to give us information directly. One of the downsides with ultrasound is that depending on the body organ, we may not be able to reach it because of the depth of the ultrasound probe. However, there are some ways around that. We've got ingenious ways of putting ultrasound probes on very small things that we can put inside the body. From a gastroenterology point of view, we've got endoscopic ultrasound. We put an ultrasound probe at the end of an endoscope, and as it passes through into the stomach, we can visualize the organs surrounding that, in particular the pancreas. And similarly, for cardiologists or heart specialists, they can put a probe again at the end of an endoscope, and as they pass down the esophagus or food pipe, they can get really good views of the back of the heart. And now, as I said, the ultrasound machines, it's called ultrasound because the sound waves that they produce are above the sound of human hearing. And there's different wavelengths, and each wavelength is designed for a different purpose. So some are very shallow and some are very deep, and depending on the body part or the body organ that's been examined, a different probe will be used. Generally speaking, from outside the body, things that can be easily examined with ultrasound, muscles, tendons, blood vessels, the heart, and different areas of the abdominal cavity, such as the spleen, kidneys, liver, gallbladder, as well as in specialized situations, for example, the intestines as well. One really neat trick is that with ultrasound, as part of the software and probe, that they can turn on to identify blood vessels. And so at the same time, they can look at the blood flow. And this can be quite important to examine if a blood vessel is blocked, so if it's narrowed. Next, we're going to be talking about magnetic resonance imaging, or MRI. Again, you may have seen this or seen it on TV or had one yourself. The setup is very similar to CT, which I forgot to mention previously, but there's a bed and there's a large donut. But unlike CT, which uses an X-ray machine within the donut, the MRI donut has very large and powerful magnets, and essentially they work on switching the polarity or the position of atoms within our body, and then when the machine is turned off, these atoms return to their normal position, releasing some energy. The easiest ways to think about that is, again, I'm not sure if you've played with magnets as a child, but if you have a compass, normally the compass points north, but if you put a magnet right next to the compass would redirect itself in line with the magnet, and the moment you take the magnet away, the compass will return to its normal position. And this is a similar situation happening with atoms in the body, and there's some subtle differences to how these atoms change, in particular in water versus fat tissue, and that gives the MRI its ability to give very high definition for soft tissues. Some of the downsides with MRI is that the machines are relatively expensive, and the test times can be long, and so it does make access a little bit tricky for different patients. While there are no radiation risk with MRI, the large magnets can cause some problems if patients have potentially materials that can be affected by magnets. And so in particular, if they've had various kinds of metallic injury, for example, to the eye or to the body, some metallic prostheses, especially the older ones, such as knee joints and hip joints, dental implants may not be MRI safe. Certain prostheses, such as pacemakers and defibrillators, can also be a problem. However, most modern technology, most modern implanted devices and prostheses are MRI safe, and it is important to check with the original manufacturer for that information. Just like CT and an X-ray, we can also use contrast dyes to give further definition or highlight certain features. However, the contrast dyes used in MRI, which is typically chemicals such as gadolinium, these again are altered by the magnets differently compared to the standard water and fat. Therefore, they release energy at a greater amount, and that gets picked up by the machine. Lastly, I'd like to talk about nuclear medicine. There was a very old joke. I remember I was a medical student. We used to talk about unclear medicine. I'm sure I got into trouble with my nuclear medicine colleagues. And the reason for that, we used to talk about jokingly about unclear medicine, is because the images are usually fuzzy. And that's unfortunately just part of the technology. And so with nuclear medicine, again, the setup is usually fairly similar. The nuclear medicine doesn't actually produce any of the effects directly. It's really only a receiver. Actual images are caused by the breakdown of what we call nuclear or radioactive traces. These can be ingested or taken by mouth or injected intravenously, and as they break down, they release energy. The amount of radiation is very, very small, and generally, again, overall very safe for the individual patient and the family. However, it is important to check with your specialist, especially if you're young or pregnant, and also if there's any other risks to your family. And when the energy is released, it's picked up by the machine, and the computer again reconstructs the images. One common test that I order is known as a gastric emptying study, and essentially it's a test designed to look at the emptying time of the stomach. And the radioactive tracer is mixed with either a bit of cereal or in the form of a sandwich. And as the patient ingests this, pictures are taken at different time points, such as 10 minutes after, 30 minutes, 1 hour, 2 hour, 4 hours. And each time, depending on how much tracer is measured within the stomach, we can do a relative calculation of the emptying time. Other scans using nuclear medicine you may have heard of include FDG PET. With FDG PET, glucose is radioactively labeled, and this is injected into the vein, and it travels around the body. And in areas where there's high metabolic activity, which is the cells are burning up more energy, more glucose is taken into that area, and that comes up as a bit of a hotspot. Just to summarize, today we talked about the different radiology technologies in terms of X-ray, CT, ultrasound, MRI, and nuclear medicine. In terms of my top priorities, it's really about using the right technology for the purpose. Other things that really are important include safety and access. I hope you enjoyed this particular episode. And again, please reach out to me directly, either online or by email if you've got any comments or suggestions. And I'll see you next time.